I recently just bumped into an article which states how 2.04 trillion naira is spent yearly on prevention and treatment of malaria. This number is huge, really. A wise woman once said, numbers don't lie. They don't lie. And truly, this number is really huge. So, one of my questions is, are there more that the medical practitioners can do to help reduce the prevalence of malaria? Are there more orientations they can give to individuals who come to the hospital every 3 months to treat malaria? The second question, is there more we can do by ourselves to kick out malaria? Of course, we can't wait for the government. We know in the time past, Nigeria was able to kick out polio. Can we as a nation kick out malaria? And so my question again is there more you and I can do to kick out malaria for ourselves? So welcome to Health Situations, where one health experience can help the other. So this is my malaria experience. I was sick and I went to the hospital. I had my tests done and I was diagnosed with malaria. I got my anti-malaria drugs, took them, and I spent nothing less than 25,000 naira. In the next 2 months, I was bitten again by an infected female Anopheles mosquito. I was diagnosed again with the same symptoms and I had malaria again. And I asked myself, how long do I want to continue this? You remember I said 2.04 trillion yearly. And I don't want to add up to that number. So I spoke to myself, I said, it's time to wise up. It's time I go the easy route. And so I decided I was going to get myself a treated net. I was going to take care of my environment and fumigate and make sure there are no stagnant waters. Because what causes malaria? An infected female Anopheles mosquito. And so I do not want to be breeding infected female Anopheles mosquitoes. I do not need them for any purpose. The third thing is get myself a repellent cream. A repellent cream always comes in handy for all those who visit the wild, hikers, those who decide to take walks at night, and then even farmers who go to their farms. A repellent does good like magic. And after putting this into consideration, the next month, after 2 months, 3 months, 4 months, 6 months and going, I had not been to the hospital again. If we by ourselves can kick out malaria for ourselves, that will go a long way. And I just recently heard that there are countries certified malaria-free by WHO. China is one of them. Can Nigeria be certified and malaria-free? This poses a big question. Yes, we can. Yes, we can do it. We've done much more in the time past and we can do this for ourselves. You and I can kick malaria out for ourselves. Checking our hospitals these days, someone said doctors are at japa.com. So most doctors are going. And so I'm left here with what? General Hospital. An average Nigerian visits the General Hospital. And what do we see in General Hospitals? Lines. And you don't want to go there sick. You would wait. You will even get sicker by the day. Yes, we can kick out malaria. And that starts with you. It starts with a mindset. Now, if you asked me to name 3 or 10 persons who have suffered malaria in the past 2 months in my circle, I'll name you 20. There's Michelle Piper, there's Chidera, there's Tion, there's Chisom, there's OD, there's Daniel. This list goes on and on and on. These are people in my circle alone that has treated malaria. So this is how we add more funds, more money. And in my 120 questions, I also have one. Do anti-malaria companies or pharmaceuticals gain from anti-malaria drugs that we take in Nigeria? That question, I do not want to answer. But I'm sure you have your own malaria experience. Have you gone to the hospital before and was treated for typhoid instead of malaria? Have you been to the hospital and you had different occurrence just because you had malaria? So I want you to go to the comment section, share, like and make your comments. Share with us, tell us your experience, your own malaria experience, and let's see how by ourselves we can kick malaria out. Do well to comment and let us interact and let us share our experiences and help others. Thank you.